How do doctors set chemotherapy treatment goals for bladder cancer? When it comes to fighting bladder cancer, understanding how treatment goals are set can help you feel more confident about your care. Doctors base their decisions on several important factors. First, they determine the stage of the cancer, which shows how far it has spread. They use systems like the TNM classification, which looks at the tumor size, whether it has reached nearby lymph nodes, and if it has spread to other parts of the body. This information is vital because it guides what kind of treatment is best. For early-stage bladder cancers that stay within the bladder wall, doctors often use intravesical chemotherapy. This means they put medicine directly into the bladder after removing the tumor with a procedure called transurethral resection. The goal here is to kill any remaining cancer cells and prevent the cancer from coming back. Sometimes, a single dose of chemotherapy is given immediately after surgery, called postoperative installation. If a patient has a higher risk of recurrence, such as multiple tumors or certain aggressive features, additional treatments might be necessary to lower that risk. In cases where the cancer has invaded the muscle of the bladder, systemic chemotherapy is usually used. This involves drugs that travel through the bloodstream to reach cancer cells throughout the body. The main goals in this situation are to shrink the tumor before surgery, called neoadjuvant chemotherapy, making it easier to remove, and to eliminate microscopic cancer cells that might have spread beyond the bladder. If chemotherapy wasn't given before surgery, doctors might recommend it afterward, known as adjuvant therapy, to target any remaining cancer cells and reduce the chance of recurrence. Sometimes, chemotherapy is combined with radiation therapy in a process called chemoradiotherapy to improve treatment effectiveness. When bladder cancer has spread to other parts of the body, chemotherapy becomes the primary treatment. The goal then shifts to controlling the disease, easing symptoms, and extending life. Doctors carefully consider each patient's overall health, age, kidney function, and personal preferences when setting these goals. Some patients may prioritize quality of life, while others may want to pursue aggressive treatments to maximize their chances of remission. Chemotherapy is usually given in cycles, with treatment periods followed by rest to help the body recover. The specific drugs used, such as gemcitabine with cisplatin or combinations like methotrexate, vinblastine, doxorubicin, and cisplatin, are chosen based on the cancer's characteristics and what the patient can tolerate. Throughout treatment, doctors monitor how well the cancer responds through imaging tests, lab work, and symptom checks. If the cancer responds well, the goal may be to continue treatment to get the best possible outcome. If side effects are too severe or the cancer doesn't respond, the focus may shift to managing symptoms and maintaining quality of life. For those receiving intravesical chemotherapy, maintaining good bladder health is important. Staying well hydrated, avoiding irritants like tobacco, and keeping regular follow-up appointments help catch any recurrence early. Patients on systemic chemotherapy should also work closely with their healthcare team to manage side effects like nausea, fatigue, or increased infection risk. Remember, every person's situation is unique, and only a healthcare professional can tailor treatment goals to your specific needs. It's always best to discuss all options, benefits, and risks with your doctor to make informed decisions. In the end, setting clear, personalized goals helps ensure that treatment aligns with your health, comfort, and hopes for the future.